Today, a patient came in the OPD with the ultrasound report shown in the background. He was having kidney stones or nephrolithiasis. He is having a burden that he doesn't want to undergo any surgery because he is the only earning member of the family. He is from the middle class or a lower middle class. He can't afford a surgery and rest period and all. So he came with the ultrasound. Sir, I don't want to do surgery. Is there any option? Because this is the ultrasound and I want to know the information. So the topic of discussion today is related to that. Kidney stones, when to do surgery and what are all the chances that stone will come out without surgery. So that is the topic of discussion today. Kidney stones, whether it will pass out automatically or spontaneously, depends on many parameters, out of which important are location of the stone. Second one, the size of the stone. Third one, shape of the stone. Fourth one is the patient hydration status. What is the hydration status in gross? And there are particular type of stone also. Today we will limit the discussion to only these four. The urinary tract, if we take, it starts from the kidney produces the urine, it comes through the pelvic calyceal system, ureter, bladder, and it passes down as you see in the background. The ureter, that is connecting the kidney and the bladder, again can be divided into upper, mid, and the lower part. Take upper ureter, mid ureter, and the lower ureter. Bladder and below you can say it as lower urinary tract. Bladder and above can be called as upper urinary tract. Location. If the stone is in the lower part of the urinary tract, high chances it will usually pass out. If it is an upper tract, if it is in the kidney itself, many a times it might not be a concern because it is not blocking the passage. So the location wise, it can be located here in the pathway or in the bladder. Most of the time, ultrasound detects only the kidney stone. It can't detect the ureter stone. It is less sensitive. Along with the location, let us come to the size. If it is less than 5 millimeter, wherever the location may be, kidney, ureter, lower ureter, bladder, it will pass out. Less than 5 mm, 5 millimeter, it will pass out. More than 10 millimeter, unlikely. That means less chances it will pass out. It might stuck somewhere. Some surgical procedure or intervention might be required. Wait. I will one more information to add. After discussing the size, I will let you know. More than 10 mm, mostly surgery. 5 to 10 mm depends on the location. If it is in the kidney, mostly it won't. If it is not causing any concern apart from pain, no need for surgery. If it is blocking the urinary pathway, yes, surgery might be required because the kidney producing urine, it is not coming down. It is getting obstructed. The pathway of urine is obstructed. Surgery might be required. 5 to 10 mm. If 5 to 10 mm is not 5 to 10 millimeter, if it is not causing obstruction to the pathway, surgery might not be required. There are medications, medical expulsive therapy. In simple term, nothing but drugs to relax the ureter and push the stone out are available. Medication can be tried. So location and size, including both, if less than 5 mm, usually pass down. More than 10, usually require surgical intervention. 5 to 10 mm in the kidney, no much concern. Pathway not blocked, no much concern. If in the lower part, usually it will expel down. In the mid part, mostly we will try with medication. We will try with medication for 4 weeks. If no response, then we will go to the intervention. What is the catch here? The size. Size is not an absolute one, because for a 100 kg male, let us take a person like very big built, like WW wrestlers, 100 kg plus, and let us take another person, male or female, only 50 kg, 55 kg on an average. Ultrasound will give the same value in millimeter for both of them. 10 mm for 100 kilogram person also, 10 mm for this small person also. So absolute value might not matter much. Here there is a clinical catch. Depends on the patient size, a nephrologist or urologist can predict how much chance is there it will pass down. So absolute value might vary in a particular patient. Second one is the ultrasound. There are observer variations. In one scan center you might find 8 mm, in another scan center you might find 10 mm. These kind of variations are also very common. Okay, 8 mm and 10 mm, these kind of variations are very common. And the third one, since ultrasound is less sensitive for the ureter stone, sometimes CT scan might be required. Okay, if the symptoms are very severe. Coming to the patient hydration, a concentrated urine stone will be keep on having that rigid shape, or it might not dissolve, or it might not pass out. Only the outer layer, if it is getting dissolved, there's a chance it will expel. So the hydration have to be very, very high. Patient hydration, around more than 3 liter of water he might require. That we will see separately regarding the treatment. But patient hydration have to be high so that it will pass out. If the hydration is low, concentrated urine, the stone might not pass out. Okay. We have seen the size, we have seen the location, then hydration, and also one more parameter is shape. Many times these absolute values might not correlate, because shape of the stone might be different as per the composition. A globular stone, a round like stone, high chances it will pass down. Whereas it is lengthy, it is having irregular shape, sticking to the ureter might not pass. So the shape, if it is smaller, because in the ultrasound measurement, many a times the dimension is bit difficult to predict even for the radiologist, because it is a two-dimensional image. Many a times stones are three-dimensional. The values might be having mild variations. So shape also plays important role, but very difficult to predict the shape in the ultrasound. Okay, so this is subtle things which will adjust it. Adjust in the sense subtle parameter which will change or adjust the treatment outcome. Okay, these are the important things which will decide. So when not to plan the surgery? First time, even if it is mild obstruction, try with medication. Only flank pain, no signs of infection, try with medication. Third, if there is a precipitating factor. What is the precipitating factor? Summer, some occupation. There are some people who are security guards, policemen, military people who could not take water on a regular basis. Even some person per se, they might not take water at adequate hydration. So these are the precipitating factor. If precipitating factor is there, and dietary factor, some stone forming diet, they are having high protein diet, high salt diet. If it is there, high chances with the medication, with this kind of hydration and avoiding concentrated urine, it will pass down. So this is the info related to the ultrasound and that person's story. In the ultrasound, the stone size and the patient built comparison wise, there is mild obstruction, but size, location, and patient other parameters, there was a precipitating factor. So we told no for intervention. He will improve with the medication. We told him to follow up in subsequent weeks. He will come in OPD. Let me update you in the subsequent videos. So this is all regarding stone when not to plan for surgery. So in the next video, what is the medical expulsive therapy which can be given for stone, we will see in that. Bye bye.